Congratulations, you had your braces placed today. We will be going over some very important instruments in keeping your teeth and these braces very clean. Remember, in addition to knowing and having the instruments, it's also important to know the techniques and dedicate the time for proper oral hygiene. The instruments we will be going over are the toothbrush, the proxibrush, water flossers, floss threaders or super floss, and Listerine. First, let's take a look at what happens when proper brushing and cleaning is not implemented. Plaque is a biofilm created by bacteria that feeds off certain dietary sugars. Plaque tends to build up around the brackets, under the wire, behind the elastic hooks, and along the gum line. It must be dislodged by a brush, floss, or water flosser. Within the plaque, the bacteria creates an acid as a byproduct from the sugar, which attacks the tooth surface. If exposed to this acid for a period of time, the tooth surfaces will break down. In this video, you will see two types of surface breakdown. The white area around the tooth is a white spot lesion, often called precavities, tooth tattoos, or acid burns. These white spots are here to stay and don't go away. The cavitated areas are cavities. Once the acid has broken down the outside layer of the tooth and cavitates the surface, it's called a cavity and must be filled. The first and most important instrument is the toothbrush. Whether you use an electric toothbrush or a manual toothbrush, in most situations does not matter. It's the duration of brushing and technique that's important. While you should make sure that you brush at least twice a day for 2 minutes at a time, it's recommended to brush after every meal. When brushing, use a circular motion, not a side-to-side motion. Brush at a diagonal angle about 45 degrees above and below the bracket. Make sure the bristles get under the wire to dislodge any plaque. Brushing very hard is not necessary. Don't forget to brush the top of the teeth, the back of the teeth, and the tongue. The proxibrush is in your oral hygiene bag. It is often called the skinny brush or the Christmas tree brush. They are often portable and reusable with a cap. They are very useful removing plaque under the wire, between the teeth, and cleaning around the brackets. Sometimes areas of irritation in the gums may indicate that you are missing an area. Use the proxibrush to clean around these areas. As with many irritations, you may see some blood. As you keep the area clean, the bleeding should go away. Floss threaders or super floss are also included in your cleaning kit. Often these flossers have a plastic point that allows you to thread the floss under the wire to floss in between the teeth. Make sure you take the floss slightly beyond the gum line on each side of each tooth. Flossing may seem time-consuming, but with some practice, flossing should not require more than 2 minutes. Plan to floss at least once a day for proper oral hygiene. As with many irritations, you may see some blood. As you keep the area clean, the bleeding should go away. Water flossers can be corded or cordless. The key is to use the high power setting. On corded devices, set the water pressure between 6 to 10 to get adequate water pressure to remove plaque in between the teeth. While you are using the device, lean facing over the sink and wrap the lips around the tip while allowing the water to drain. They are also very effective in cleaning under appliances such as expanders. Lastly, Listerine is an antiseptic mouthwash that kills bacteria that causes gingivitis and gum disease. We recommend Listerine Zero, which has no alcohol, but it has the active ingredient of the essential oils, which has the antiseptic properties. Again, congratulations for getting your braces on, and ask me or our knowledgeable techs if you have any questions.